finding this Tadasana shape, mountain pose shape, with your legs hip distance or slightly wider. This shape, Amy Cuddy has done some research and talks about on a TED Talk how our body language or the shapes that we hold our body in affect our hormones. And this shape, as well as this shape that you could do standing or seated, helps to, after just 2 minutes, lowers your cortisol by 25%, leaving you with a sense of calm confidence. So during these times, maybe this is a shape you create in your body for a few moments to support yourself, whether it's anxiety overwhelming you through your pregnancy or just in our current situation. Maybe take this shape and notice how you feel. And so we'll stand here for just a few more moments. I invite you to close your eyes or let the gaze shift down towards the floor in front of you and really press your feet down into the floor. Notice the texture of your mat. Invite a little more weight towards the center of your heels, letting your thigh bones move in and slightly back. And the tailbone releases down as the crown of the head lifts. Rolling the shoulders onto the back, feeling the broadness across the chest, the strength and broadness of your back. Notice your breath moving through your body in this shape. So this shape also has the effect of opening up the rib cage, opening up the lungs. And then I invite you to go ahead and move your hands, interlace your fingers behind your head and notice how that feels. Reaching your elbows out to the sides. And invite the back ribs to lift up as you press down into your feet. Feel your breath moving through your body. And as you exhale, release the hands down and notice what you feel. Rotating the arms open, you can open the eyes or lifting the gaze, feeling the shoulder blades firming onto the back. As you inhale, reach the arms out, slightly forward and up, feeling the lift of the back ribs, pressing down through the heels. And as you exhale, bring your hands together and down through the heart center. Feel your thumbs pressing into the sternum, inhaling and exhaling. One more time like that. As you inhale, reach the arms out, forward and up. And exhale, hands come together down through the heart center. Inhaling and exhaling. Inhale, reach the arms out and up this time, taking hold of your left wrist and lengthening up, stretching up and over to the right. So press down into both feet, middle, maybe a little bit firmer through that left foot. And inhale, coming back through center. Exhale the hands together down through the heart center and notice if there's a difference between the left and right side. Exhale the hands down. Inhale, reach the arms out and up. This time take hold of the right wrist, maybe spiral that palm up. Lengthening up to the back and the sides of the body, stretching over to the left. Pressing down into both feet, maybe a little firmer press through that right foot. Notice what you feel. And inhale, coming back up. Exhale, hands down through the heart center and pause. Releasing your hands down. Moving on, inhale, reach the arms out and up. As you exhale, hinging forward at the hips, bending at the hips, bending at the knees. Reach your sit bones back, arms to the thighs. And then bring your hands to the mat to walk yourself down into your dog pose. Or you could come down to your knees, for your puppy pose. So the toes stay tucked under, hips over the knees, walking the hands forward, and you're pressing down and back through the hands. So that's your modification for dog pose. If neither one feels okay, you could always rest back on the heels or on the block, or you could also do a dog pose at the wall. So hands at about rib cage height, walking your feet back, letting your knees bend, and let your feet be a little wider than hip distance. So this is your modification for dog pose. And especially just remember, after about that 32nd week or 34th week, baby's head down, you want to avoid the standard dog pose, as the baby might turn back over into a breech position. Exhale down to your knees if you're still up in your dog pose, resting back in child's pose, either with a block, books, or fists underneath your forehead. Sensing your breath in the back body. Exhale completely. As you inhale, rise back up. From here, bring your blocks in, or maybe your stack of books can come onto the left side of your mat, and step your right foot forward. You want to line your right knee up over your ankle or your heel. You could have a blanket under that left knee if that feels better. You can stay down on the blocks or hand to that thigh, or press down into your feet, taking the arms forward and up, hugging the baby in, pinky finger spiral in towards the midline, lifting from the back ribs up, really pressing down through the feet, and exhale, hands to the blocks, stepping that right leg back, blocks to the right side now to step the left foot forward, left ankle underneath that knee, pressing down into the feet. Inhale, reaching the arms forward and up, hugging the baby in, lifting the back ribs up, lengthening through the sides of your body. And exhale, hands to the blocks, stepping that leg back, blocks to the sides, coming into your puppy or dog pose, listening to your body. You could pedal your heels, or if you're staying down on hands and knees, you might also wiggle the hips a little bit. Do what feels good in your body. And exhale, lower down, resting in child's pose, or sitting back on the heels, closing the eyes or softening the gaze. Sense your breath in the back of your body, the sides of your body. Exhaling completely. As you inhale, rise back up. And then tucking your toes under, walking your hands back. Have your knees about mat width apart, rolling over the soles of your feet, and bring your arms to your thighs. Bring your hands to your thighs. Keep your knees bent. And as you exhale, tuck your tailbone, rounding your back. As you inhale, let the sit bones reach back and the heart reaches forward. As you exhale, coming into that cat shape. Inhale, opening into your back bend. A few more breaths. Really pressing down into your feet. And as you exhale, come to a neutral spine, folding over, hands to the mat, walking forward again, coming back into your dog pose or into your puppy pose shape. Do what feels best in your body. And exhale down to your knees, resting in child's pose. Or sitting back on your heels. And if you're in your child's pose shape, you might notice any sensations of movement in the pelvis as you breathe. Maybe you feel how around the tailbone, the base of the sacrum slightly lifts as you inhale and releases back down as you exhale. It's very subtle, just with a sense of curiosity, notice what you feel. And on your exhale, pressing your hands into the mat, walking your body back up. And again, bringing the knees mat width apart, walk your hands back, lifting onto the feet, arms to your thighs, pressing down into your feet. Inhale, reaching up. Exhale, hands come to the heart center, pressing your thumbs into the sternum. Inhale, exhale. Standing in the middle of the width and the length of your mat. If you have a blanket on your mat, please take that off so you don't trip on that. And step your feet about 3 feet apart. So you could take your wrist out, look to see that your ankles are underneath your wrists. And if you're having pubic bone pain, I'll show you a modification in 1 minute. If you're having SI joint pain, be very mindful here. If you have any pain across the back of the pelvis, you could also do the modification that I demonstrate in a minute. So if you're doing the full pose, internally rotate your left thigh, knee, and toes. Externally rotate the right thigh, knee, and toes, walking that over a little bit so that you're heel to heel. Or you could even use more of the width of your mat to have your legs further apart. As you inhale, press down into your feet, drawing your shoulder blades onto your back. As you exhale, bend that right knee, aiming your knee towards your middle toes, pressing down into both feet. And square your pelvis. So notice if your back hip is lifting, can you let the hips be level? Maybe bring your hands there to find that balance in the pelvis. And then gazing over the fingers of that right hand, keep aiming your right knee towards your middle toes, coming into your warrior pose. And then as you exhale, release your left hand down, flipping your right palm up. Inhale, lifting up. So you could look up or you could look straight ahead. Do what feels best in your body. Keep aiming that right knee towards your middle toes and reach up towards the ceiling with that right hand. Rolling the left shoulder onto your back. Again, feel both feet pressing strongly into the floor. And as you exhale, come back into your warrior two. And from here, as you inhale, reach forward, placing that right arm or right hand onto your thigh. And then sweep the left arm down the front with the palm facing behind you. Press from the outer edge of your pinky toe and feel the length of that whole left side of your body. You could gaze under that left arm or gaze down at your right foot. Keep aiming the right knee towards the middle toes, pressing into the outer edge of your back foot as well. Smooth, even breath. As you exhale, gaze down at your right foot. Inhale, back up to your warrior two. And on your inhale, straighten that right leg. Exhale the arms down, feet parallel. Toe heel them in, or just step them together. Placing one hand on your heart, your other hand on your baby. You could close the eyes or soften the gaze. Feel both feet pressing down into the floor. Feel your breath moving under your hands. Maybe your heart's beating a little faster. Notice what you feel. And as you exhale, release, and we'll do the second side. I'd also like to show modification. So if you are modifying due to any pelvic floor pain or pain across the side joint, you can sit in a chair with a block between your thighs. If you don't have a block, you could roll a beach towel and wrap it with duct tape as another option. And hugging your thighs into that block, have your ankles under your knees, and I have the block at the middle width. And from here, so you're engaging the core, creating some stability in the pelvic floor and in the pelvis, and you can do the arm parts of the poses. So for warrior two, you could be here. For reverse, you could bring this hand to the chair if that feels good and reach up. And then for the side angle, you could bring your hand to the block and stretch this arm, and again, spiraling it in, or a little more stability would be to put that right hand on the side of the chair. So do what feels best in your body. Moving on to the second side. Stepping your feet, again, about 3 feet apart. Ankles line up underneath the wrists. Internally rotate that right thigh, knee, and toes. Externally rotate the left thigh, knee, and toes. Walk your feet so you're heel to heel. And for starters, let's bring the hands to the hips, bending that left knee, aiming it towards your middle toes. And then press down into the outer edge of your back foot. Square the pelvis. So make sure that that right hip point is not lifting, but that the hips are level. Keep aiming that left knee towards the middle toes. Press strongly down into your feet and float your arms up, shoulders on the back. Bring the gaze over the left fingers. Shoulders relaxing down away from the ears. Feel both feet pressing strongly down into the earth. As you exhale, right hand comes down, left palm flips. Reach straight up to the ceiling. Again, keep the neck comfortable. And exhale back into warrior two. From here, press through the back foot, reach forward, tipping that left hip point back, left hand or arm to that thigh, sweeping that right arm down the front. And feel that extension from the press of the outer edge of the back foot all the way to the fingers of that right arm. Look to see that your left knee is moving towards your middle toes, staying over your heel or ankle. As you exhale, gaze down, inhale, come back up. And on your next inhalation, straightening that left leg, exhale the arms down, feet parallel, step them together. And this time, placing the opposite hand on your baby, other hand on your heart. You can close the eyes or soften the gaze. Feel your feet pressing down into the floor. Feel your breath. And as you exhale, release the hands. Step the feet wide and externally rotate thighs, knees, and toes so that when you bend your knees go over your ankles but in line with your toes. And as you inhale, reach your arms up, and on your exhale, coming into your squat, sweeping your arms down as if you're scooping up flowers. And then inhale, rise back up, opening the arms. Exhale, folding in. Inhale, press strongly through the legs. Reach the arms out and up. Exhale, folding in. And this time, as you exhale, bring your hands to your thighs. As you inhale, press down into your feet, reach your arms up. As you exhale, back of the hands to the thighs. Press down into the feet, lift up, exhale, coming down. 2 more. Last one. Bring your hands to your thighs. Let your sit bones reach back. And then keep the feet slightly externally rotated, thighs and knees externally rotated as well. Gliding back and forth. Again, listening to your body. Do what feels comfortable. You could have a chair in front of you for support, or blocks on the floor. And coming to center, bring your toes forward, bring the feet in, and bring your body all the way up to mountain pose. And notice what you feel. We'll do a chair flowing sequence. You can watch first. We'll sit back in our chair so our legs are hip distance or slightly wider, making room for the baby. Reaching your arms forward, or you could reach up, depend on what feels best in your shoulders and neck. And as you exhale, we're going to press down into the feet. Hands come to the heart. Shift the weight to the right leg. Lift the left. And then sitting back into that chair. Switching sides. Pressing down. Lifting the opposite foot. And step down into your chair. So you could keep your hands at the heart center the whole time. You could also shift your weight and keep the toes down for added support. You could also have a chair in front of you as well. So do what feels best. And let's start this together. Sitting back into your chair. Hug the baby into the back. Keep the chest nice and broad. Breathe. As you exhale, hands come to the heart center, shifting your weight, stepping in, lifting the right. Inhale into your chair. Exhale, press in, lift the left. Inhale, sit back. Exhale, stand. Inhale again, the hands can stay at the heart center. And breathe. Working the abductors of both legs as well as the adductors. One more time. And pause in your chair shape. And exhale, press down to standing. Good. Roll your shoulders up, back, and down. And let's make some hip circles, taking the feet a little wider. You can externally rotate thighs, knees, and toes. You can make figure eights. And reversing that. And coming to neutral. And coming to a Tadasana at the top of, or at the back of your mat. And finding your mountain pose. Feeling down into both feet. Externally rotate the arms as you inhale, reach up. Pressing down into the feet as you lift up. Exhale, hands come through heart center. Toe your feet a little wider, hinging at the hips, bending at the knees, arms to the thighs. Walk your hands down and coming onto hands and knees for some more cat-cow. Wrists an inch in front of the shoulders, knees under the hips, elbows stay soft. Rounding into your cat shape, inhaling to neutral or into your back bend.